One of the things to help prevent obesity that healthcare professionals can do is help parents to make small changes within the family lifestyle in order to create a healthy lifestyle environment around the child. Now that means it's really important that parents don't expect the child to do anything that they're not prepared to do themselves. So the parent has to role model all the behaviours they want their child to follow and copy and grow up learning that that's the right way to do things. So it's about giving a balanced diet and about limiting snacks, avoiding any grazing on sweet food and sweet drinks between meals. The simple practical tools that the ITF have developed for healthcare professionals to use with parents, the first one is the 10 steps for healthy toddlers, and this gives parents an idea of how to manage meal times, so particularly around fussy eating as well as around avoiding obesity, so limiting the portion sizes, limiting the times when children eat, making sure they get enough sleep and making sure they have plenty of physical activity through the day. And this 10 steps is just, as it says, really simply worded 10 steps that parents can read quite quickly and adopt. And they can also discuss it with the parent to see maybe which ones they'd like to start with so that they're not making a whole lot of changes altogether. Now the second resource that we introduced today that's going to help prevent childhood obesity particularly is the portion sizes for toddlers who are 1 to 4 years old. Now these for each food that a parent will normally use, we've given a portion size range, so there's a minimum amount and a maximum amount. So when the child's not eating very well, they might eat a smaller amount, and when they're eating better, they'll eat a maximum amount. But the parent can be confident that if the child's eating within that range, then they're getting enough to get all their nutrients. Now, if they are overweight or they're a child that tends to eat too much, then the parent can restrict them to eat within that range. And similarly for a younger child who doesn't eat well, it gives the parents reassurance that they are actually eating enough and stops them putting pressure on that child to eat more than they need, which is really important in preventing obesity as well, that toddlers are allowed to eat to their appetite, and this portion size fact sheet will help a long way with that. I think the one thing that healthcare professionals could take away from today is that if children are overweight or obese, it's because they're eating more than they need. So the one thing that healthcare professionals could help parents with is giving them the portion size fact sheet so that they will know how much is enough of each food each time they serve it.